Social determinants of health. What are they, and how is COVID-19 teaching us something new about this important topic? Ray Hanley, CEO of the Arkansas Foundation for Medical Care, joins us. Ray, I want you to tell me, first of all, what are social determinants of health? Can you give me a definition?
Yes, I will, Roby. It's a relatively new term to medicine, but, the World Health Organization, which of course has been much in the news lately, actually has a definition, and it's that the conditions in which people are born, grow, live, work, and age. And the Journal of Preventive Medicine wrote an article lately, and it says medical care itself accounts for only 10 to 20% of modifiable contributors to one's health, that 80 to 90% are really influenced by the social determinants of health. Health-related behavior, smoking, diet, exercise, environmental factors, where people live, where they work. And we've certainly seen that in the COVID-19 experience, that in poor neighborhoods, the rate of infection is twice as high. Black citizens have been twice as likely to be infected, much more likely to be hospitalized. Living conditions, access to health care, underlying conditions like obesity, diabetes, certainly influence how susceptible we've been to this disease. And the challenge then is how the medical community, deals with it. And largely as well, how the payers embrace it. Are the payers, third-party payers, willing to work with the providers to recognize the value of having a mental health worker, a social worker in a practice to work with patients when they're leaving their appointments, when they're discharged? What are they going home to? Is there a caregiver? Are the utilities on? Is there food? Do they have transportation to their next appointments? And these are considerable factors that influence how much they benefit or don't benefit from the expensive medical care that the third-party payers have provided.
I want you to back up a little. COVID-19 has shown us some things about social determinants of health that have risen to the forefront a little bit more. Tell me, what do you think have been some of the biggest takeaways for how the coronavirus has impacted social determinants of health?
Well, we've certainly learned how contagious it is, since this started. We've learned that, crowded living conditions, close proximity spreads it. We have learned that people that have underlying health conditions are much more susceptible to COVID-19, sicker when they get it, more likely to be hospitalized, more likely to die. And when you look at some of the underlying conditions in the particularly low-income populations, whether it's obesity, diabetes, hypertension, these are factors that have made them more susceptible. And when you look at living conditions, and which are going to be more crowded sometimes, particularly in urban areas, minority neighborhoods, it's all contributed to putting people at higher risk.
You mentioned minorities earlier. We do see that COVID-19 does affect African Americans at a greater rate than other population groups. We're obviously seeing an influx in Arkansas in the Latino community. Is it because of the environmental conditions as well as underlying health conditions, or is it more than that?
I think it is all of that, Roby. It's certainly crowded living conditions. And if you look at some of the really hardworking folks in the Black and Hispanic communities, a lot of them, they haven't had the luxury of being able to work from home remotely like you and I have. They've got a lot of them soldier on, are still out there producing food and services and putting themselves more at risk by simply the nature to which they have to learn a living. A lot of them have been some of the first laid off, which again, lacking an option to work from home. The stresses of losing your job have certainly been more prominent in minority communities.
Well, I've heard at least one solution here, since we know that social determinants affect health outcomes. You mentioned third-party payers stepping up more, but how do we make improvements? Is it policy? Is it regulatory solutions? Is it something individuals have to do better, or is it even something beyond that?
I think we started, several years ago, all the payers working on a system of payments that weren't just tied to fee for service, but were based on outcome, and providers that could influence and improve outcomes, got paid more. That's stalled. I think we probably need to revisit that and give the providers the tools and the financial incentives to put that mental health worker into the practice, to use a social worker, to do home visits, where needed, and try to improve the conditions in which the patient obviously lives and works 99% of the time when they're not in the doctor's office or the ER or the hospital. Because you can provide the world-class medical care, but if they're, again, discharged to a home that is not sanitary, where there's not a caregiver, where there's inadequate food, where the utilities may or may not be on, where they may or may not have transportation for the new appointments next week, all that takes a toll. And with the right screening and the right support services, things that a busy physician doesn't have time to do, but a social worker, a mental health worker, working with the patient before they go home does, that has great value, but it comes at an expense that payers need to recognize and embrace, because in the long run, if we improve the health status, that's going to save the payers money.
So who pulls all of that together, Ray, and advances this as a cause? Is this a state or federal leadership? Is it the private sector? Is it something at the community level?
I think ideally it's all of that. I think certainly at a federal level, CMS can influence that. They certainly make all the rules for Medicare, which covers a huge section of Arkansas folks, and a lot of them are low-income, elderly. They make most of the rules for Medicaid, the state administers, so I think they've got a really large role to play in this. But I think the medical community and the third-party payers here in the state also can do a better job of collaborating on this.
All right, preach on. He is Ray Hanley, CEO of the Arkansas Foundation for Medical Care. Thanks, as always.
Thank you, Roby, for having me.